We're going to talk much more about this. Dr. Karen Eggleston joins us. She's director of Stanford University's Asia Health Policy Program. Doctor, welcome to Biz Asia America. This is a topic we've wanted to talk about for a long time, so I'm very happy that we're getting an opportunity to do so. Asia, China, they all have the same problem. There's a lot of old people. They're living way past 80. Whose job and who's responsible for taking care of them?
Well, thank you. It's a pleasure to be here. Yes, as you've noticed, it's a big challenge. It probably should be recognized as a wonderful opportunity and a great success that people are living longer and generally healthier lives. But it does present a whole series of policy challenges, so we can talk about what all of those are. A lot of my research is related to China, so we could talk about that specifically. We know that other areas of East Asia are leading in the world. You just talked about Singapore, Japan, already leading the world. In terms of population aging, South Korea rapidly aging.
Let me just start with money. In the United States,
yes,
the average person, okay, spends basically 70 to 8% of all their life savings and medical costs in the last 2 years before they die. Now, I'm going to imagine that number isn't so far off the rest of the world, but ultimately, the savings rate, while it's high in Asia, there's this expectation that your children, your sons and daughters ultimately are responsible for you when you get old and you're unable to take care of yourself. Does that model still work in Asia with healthcare costs rising?
Well, it's a challenge everywhere. And there is this model of households caring for the elderly, and that will be increasingly challenged by smaller and smaller families, the adult children working places where their parents cannot necessarily join them, is often the case in China. And there are lots of challenges to that household support model. So many places have tried to step in with additional social policies and are trying to cross the river while filling the stones, to use a China metaphor, to figure out what works best in the given local context.
My grandmother's in a nursing home here in the United States, and of course she hates it. She doesn't want to be there. None of her friends want to be in nursing homes. It's not some place that you actually want to go to. And I would imagine she's from China, and a lot of folks in China probably feel the same way about nursing homes. But here's the problem. Where do you put them when they need that special assistance? And are those facilities even available in China?
Yes, well, there's a misperception that everybody in the West lives in a nursing home. As you know, that's not true. And the majority of the elderly, although they may have to use a nursing home at some point, live at home and get services in the community. And this is the traditional model in Asia. In China, as you noted, few people want to spend a lot of their time in a nursing home. There's a burgeoning industry. Just this summer, we were visiting several places in China, Nanjing, Shanghai, where there are subsidies for nursing home beds for elderly homes that are not exactly the same as nursing homes. There's a big opportunity for daycare centers where the family brings the elderly person during the day, but they could come home at night. For expansion of social organizations working in the community with the elderly. There are many opportunities, and it is a growing sector in East Asia and China in particular.
Here we have Social Security, Medicare, Obamacare, give it whatever name you want, but there is a role that the government plays in taking care of its citizens. Over in Asia, yes, China, Japan, the government there also has a responsibility. And I guess my question to you is China doing enough or focused enough on this problem right now?
Well, certainly the Chinese authorities have rolled out a great number of programs that have made a difference. There's been expansion of health insurance coverage. There's been a new introduction for the first time of pension policy in rural areas. But these are just some policies, and they've just started to address the scope of the problem. And China is a huge and diverse country, and it's aging quite rapidly. And with the large urbanization problems, interaction with large gender imbalance, and many other issues facing China as the growth slows, it's just a large challenge.
Dr.
So there are many
Karen
more
Eggleston,
yes.
I apologize, we're out of time. I want to thank you very much joining us from
Thank you very much. It was a pleasure.
California at Stanford University.